our media conference today and turn it over to Mary McFadyen. Thank you.
Thank you, Leila. Thank you, everybody, for joining us today. I'm Mary McFadyen. I'm the Provincial Ombudsman. So on November the 20th last year, a COVID outbreak was declared at Extendicare Parkside, which is a long-term care facility here in Regina, Saskatchewan. Parkside had 198 residents at the time. 194 of them would ultimately contract COVID-19. 42 positive residents passed away during the outbreak. For 39 of those residents, the cause of death was deemed to be COVID-19. On January the 29th, the Minister of Seniors asked me to investigate the circumstances surrounding the outbreak and to specifically look at the actions of Extendicare Canada Inc., which runs Parkside. As an officer of the Legislative Assembly, my office is independent of the executive government. We decide what we will investigate. We did accept the minister's request, and we also decided to investigate the Saskatchewan Health Authorities and the Ministry of Health's role in providing oversight and support to Parkside during this time. Our report, Caring in Crisis, was tabled today with the Legislative Assembly. I'm here today to provide you with a brief overview of our report, our findings, and to answer your questions. As an ombudsman, facts are the most important part of any investigation. The first thing we did was try to establish a timeline of the outbreak. We looked at how and when COVID got into Parkside and how it spread once it got in. We tried to show just how quickly the crisis got worse because of the delays in getting test results and how Parkside's decisions in dealing with the outbreak were always based on incomplete information about the actual number of infected people. For example, on the day the outbreak was declared, Parkside knew about 2 positive cases, but there were actually 23 more people who had COVID-19 symptoms. We focused on the various policies, directives, guidelines, and public health orders issued by the ministry, the authority, and Extendicare itself, which Parkside was expected to meet to get ready for the pandemic and a possible outbreak. We also looked at what role the ministry and the authority had, or what they did, to make sure Parkside was meeting these requirements. Beginning in March 2020, public health orders were issued to try to keep all of us from getting COVID-19. Including long-term care residents, and to keep it out of long-term care homes. These orders included keeping 2 meters apart and wearing a mask when this was not possible, and requiring long-term care homes to screen visitors and their staff entering the facilities and to refuse them entry if they had COVID-19 symptoms. By April 2020, all long-term care staff were required to be cohorted, meaning they could only work in one facility. Our investigation report looks in detail at 5 main areas. I will briefly mention some of our findings today. First area we looked at was general pandemic planning. By late October 2020, Parkside had not yet fully implemented many of the key requirements that both the authority and Extendicare had determined were necessary for it to be able to effectively respond to a serious outbreak. We found little indication that Extendicare at a corporate level was effective in making sure Parkside was able to successfully implement a facility-specific pandemic plan that properly dealt with the limitations of its facility. The second area we looked at was Parkside's physical layout and limitations. Parkside was built in the 60s. It was designed to have 228 beds. At full capacity, 136 residents were living 4 to a room. Authority officials told us Parkside is generally very crowded and the infrastructure does not lend itself to disease control. The authority and Extendicare had discussions about Parkside and its crowded conditions would make the managing of the risk of COVID-19 spreading more difficult. It was first discussed in late March and early April when the ministry imposed resident dining restrictions. By mid-June 2020, Parkside was flagged as a facility of concern. Into August, Extendicare and the authority discussed reducing Parkside's resident population, but neither of them offered the other a clear plan for how it could be done or took steps to make sure it happened before the outbreak. The Minister of Seniors specifically asked us to investigate if the physical condition of the Parkside facility had an impact on the outbreak. That answer is clearly yes. disease control was a problem, Parkside had 13 other outbreaks in 2020 before the COVID-19 outbreak in November. While ministry officials told us during our investigation that they were not aware of the challenges that Parkside would have in complying with public health orders until after the outbreak occurred, they were aware that Extendicare has been lobbying the Minister of Health directly for years to get its Regina facilities replaced because they were old and did not comply with reasonable standards. Extendicare even made a presentation to the minister about the redevelopment project during the pandemic. The third area we focused on was the supply and use of procedure masks. Despite early concerns of shortages, there was an adequate supply of masks by mid-April 2020. The authority was providing all long-term care operators, including Parkside, with procedure masks free of charge. Both the authority and Extendicare instituted continuous masking rules for long-term care staff. The authority's guidelines required staff to change their mask after every break. This meant using 4 masks per shift. Extendicare's corporate-wide rules required its staff to use 1 mask per shift and store it in a paper bag while on breaks, but its rules also said that its Saskatchewan homes should follow Saskatchewan rules. Parkside did not comply with Saskatchewan rules. While the authority tried to get Extendicare to comply, Extendicare resisted, and the authority did not insist. We raised this issue to make the point that the authority's hands-off approach to Extendicare, coupled with Extendicare's back-off approach to the authority, resulted in the two organizations not working together as collaboratively as they could have and should have. The authority pays Extendicare to provide long-term care. However, authority officials felt because Extendicare is a private company, it could not force it to comply with the authority's rules. It needs to be clear in all contracts and to all authority officials that they have the right to insist that private operators comply with the authority's care-related policies, guidelines, and standards. Whether you are living in an authority-run home or a privately operated home, you are entitled to the same quality of care. And whether homes are providing that care needs to be reported on and publicly available. The fourth area we looked at was the steps taken to limit the spread of COVID-19 from resident to resident. It was difficult for Parkside to comply with the public health orders that limited the size of indoor public gatherings. For example, at certain times, the limit was 10 people. It was nearly impossible for Parkside to comply with that order, to have only 10 people in a dining room at one time and to feed 200 plus residents 3 meals a day and properly clean dining rooms between sittings. It was also impossible for it to maintain physical distancing between 4 residents who were sharing 1 bedroom. Despite the authority and Extendicare knowing and discussing these issues, again, no steps were taken to reduce Parkside's resident population to make it easier for it to comply with public health orders. 2 weeks before the outbreak, on November the 6th, a masking order came into effect in Regina, Saskatoon, and Prince Albert. It became province-wide on November the 18th. All residents were to be masked outside their bedrooms, subject to certain exceptions. Parkside was not masking residents in the days leading up to the outbreak. Some authority officials also did not realize this masking requirement applied to residents until well into December. So it is possible that other long-term care homes were also not in compliance. The last area we looked at was staffing issues. We found that its process for screening staff for symptoms before they entered the building was not enforced consistently and was therefore not effective. It was clear that staff were coming into Parkside with symptoms and were caring for residents. This is how COVID-19 got into the facility. We also found that many staff were not physically distancing from each other on their breaks and did not wear masks when they interacted with each other. There was ample evidence that many of Parkside staff had to self-isolate because they reported being unmasked and in close contact with their COVID-19 positive co-workers. All facilities were to have a staff contingency plan. Extendicare's corporate plan noted that in the event of an outbreak, between 20% and 50% of staff could be absent due to being ill or being directed to self-isolate. So homes needed to have a plan ready for that risk. Parkside did not have this in place. At a corporate level, Extendicare did not ensure that Parkside was ready. Parkside was left scrambling to try to get people to help care for residents after the outbreak started. Even days into the outbreak, neither Extendicare or Parkside's management or authority officials realized that the authority could not simply ask its staff to go in and work at Parkside to help during the outbreak. This is because Extendicare is not an official affiliate of the authority like most other private long-term care operators in Saskatchewan, and it did not have access to the authority's labor pool. As for the Saskatchewan Health Authority, we found that it gave reasonable support to Parkside during the pandemic and outbreak. Based on the information we reviewed, there was probably not a day that went by during the pandemic that the authority officials did not reach out to Parkside and other long-term care facilities about some aspect of the pandemic. However, there were some areas where we found oversight was lacking. We've made 8 recommendations to Extendicare and the authority that are aimed at improving how long-term care is provided and overseen in Saskatchewan. In particular, we have recommended to Extendicare that, in collaboration with the authority, it conduct a critical incident review as it is required to do under provincial legislation. This review is required whenever there is a serious adverse health event, including loss of life. 39 residents dying of COVID-19 is, in our view, a serious adverse health event. Both entities should take the opportunity to review what happened from a clinical, medical, infection prevention and control perspective, learn from mistakes, and minimize the chance of this happening again in another long-term care home. We have asked both the authority and Parkside to report publicly on whether they accept our recommendations and on the timelines for their implementation. As for the Ministry of Health, it provides the governing framework for the long-term care system and funds the authority to provide that care. It provided no direct oversight or support to Parkside. We were told the ministry does not get involved in the operational part of the healthcare system. However, the ministry has a critical role. It decides what health services will be provided and how it will be funded. In 2015, in our Taking Care report, we recommended that the ministry, in consultation with the health regions and stakeholders, identify the care needs of long-term care residents and the factors affecting the quality of long-term care delivery in Saskatchewan, and that it develop and implement a strategy that deals with those issues and publicly report on it. We have an aging population, and these issues are not going to go away. In our view, this recommendation, or the intent of this recommendation, has not been met. In closing, I just want to comment a bit on our investigation. We interviewed over 100 people. Most officials we interviewed were forthright in their responses. Many were very emotional. It is clear that nobody wanted this to happen. We also interviewed family members. I hope that it's not too distressing to have the events of the outbreak made public, but it is important for the public to fully understand what happened so that we can prevent it from happening again. I know that I am going to be asked this question. What if all the rules and orders that you found were not complied with were actually followed? Would that have prevented this tragedy? I cannot answer that question, but it surely should have helped if Extendicare Parkside was more prepared and the authority felt it had the right to insist that it be prepared. These residents were supposed to be properly cared for, treated with respect and dignity, and kept safe. In our view, they were not. If our recommendations are implemented, the changes should benefit long-term care residents in the future. Thank you very much, and I would be pleased to answer any questions. Thank you.
Thanks, Mary. And I just encourage media who are on the line to put a note in the chat when you're ready to ask a question, and I will unmute you so that you can do so. Okay. Thank you for that. We are going to go to Lisa Schick, who has requested that. Now, you may also, I just want to note, I will unmute you, but you also have to make sure that you have unmuted yourself. So just check that, Lisa, on yours. I have unmuted you. There you go. Please ask your question.
Can you hear me all right?
Yep.
Yep.
when you were, I guess, writing up this report and doing this investigation, there are a lot of things in this report. I'm just wondering if there's anything in particular that stood out to you as particularly concerning in these cases.
Well, to us, I thought it was important to show what actually happened during the outbreak and what a crisis it was. I mean, it was in real time. Everything was happening so fast, and that's why it really showed the need to be prepared. To me, I think what stands out to me, and what I think is probably one of the most important recommendations we made, is that they need to do a critical incident review. So this is something that's required if there's a serious adverse health event. They look at clinical issues, medical issues, infection prevention control, whether testing should have been done earlier, if testing was delayed. And then they can look at it from that medical perspective and see what went wrong so that it doesn't happen again. I mean, that's the process for them to figure out. We look at administrative processes and whether they were followed. They are the experts in running long-term care homes and in medical and clinical issues, and they need to figure that out, hopefully, so that this would not happen again.
And just one more question. In the timeline, you had a lot of information about employees and them going in when they had symptoms and being around other people, other workers without a mask on. Was it difficult to get that information from the employees truthfully, I guess?
We found everybody was very truthful with us. When we spoke to them, we had information from contact tracers. As an ombudsman's office, because we have wide investigation powers, we have the power to access that information. We're very careful about how we treat it. That's why we were very careful in putting any health information out there to make sure nobody could be identified. Everybody was very honest. I have to say, maybe everybody was quite honest with the information they provided to us. And we were very clear to them that they could be honest with us because we would not be identifying them. We thought it was important to get out what actually happened into the public domain.
Right. Thank you, Lisa. Did you have anything more?
No, that's all for me. Thanks.
Okay, thank you. Next we have Arthur White-Crummy. So Arthur, I will unmute you, and when you unmute yourself, you are ready to go.
Can you hear me now?
Yep.
Wonderful, thanks. So there's been a lot of discussion throughout the pandemic about the role of broader systemic factors within the long-term care system in sort of precipitating this. And I'm wondering whether you found that overall staffing levels, not just the staffing crisis imposed by the pandemic, but overall staffing levels, funding, the quality of care standards themselves, whether any of that is, sort of, under the political control of the government played a role in this particular crisis.
Well, when we did this investigation, we really looked at what happened at Parkside during this time period, what was in place at the time that they were supposed to meet, and whether there was oversight. It is true that when we did this investigation, when we did our investigation back in 2015, we get lots of information about, the funding model hasn't changed. We clearly put that in the report again. How much funding is given, the staffing isn't proper, there's not enough of a certain amount of people. Those are all very good questions. That is why we think it's vital that the Ministry of Health, who has the power to decide what services are given and how funding is given, that they look at this from that perspective. We as an ombudsman, we look at when the legislation's in place, what administrative actions are taken to implement them, and are they done properly and reasonably. But these are matters of public policy that need to be discussed, and the Ministry of Health should look at that.
Most of your recommendations focused on the company and the SHA itself. I'm wondering what extent you think that the leadership at the ministry itself played a role in allowing this crisis to happen?
Well, I'll tell you, as we put in our report, every official at the ministry that we interviewed was very clear to us that they had no direct oversight or gave support to Parkside. We focused on what happened at Parkside, and I mean, the ministry has decided that it's operational, the operational part of the healthcare system is with the Saskatchewan Health Authority. So that is why our recommendations focused on the health authority, who has the obligation to oversee when they enter into contracts with private operators, that the standards, guidelines, what they think is necessary to be running an old folks home properly is followed. So that is why we focused on our recommendations on those two entities.
Yeah, I mean, it seemed like in some ways the sort of nature of the contract here with Extendicare played a role in these miscommunications. Like you said, they weren't able to access staff as well because they weren't considered to be an affiliate home. I'm wondering whether you think that the private care home operator model and the way that that's regulated in Saskatchewan played a role in the extent of this outbreak.
Well, first of all, with respect to the contracts are vague in my opinion. We've recommended that they update them and make it clear, and it's clear that authority officials did not feel how far they could push a private care home operator. We have private care home operators in Saskatchewan. I mean, we have nonprofit ones, for-profit ones. That's again a public policy decision for the government to decide who it contracts with. What is in legislation, though, is under the Act and regulations, it has Extendicare is a healthcare organization, but it's not listed as an affiliate. And so because it wasn't an affiliate, it wasn't part of the big letter of understanding that the authority entered into on behalf of all the affiliates so that it could move staff around if it had to, it could cohort staff, all of the things that needed to do to deal with the pandemic. But because Extendicare is considered separate, it had its own bargaining unions with the healthcare unions. So that was an issue. That is in legislation that they are not an affiliate. But it was clear that Extendicare officials themselves, dealing with their labor relations things, the authority did not understand that legally they were not an affiliate. So the authority just could not come in and take over or bring their staff over because of that fact. And that's why they had to enter into a co-management agreement. As far as we can tell, that was the way that they could get into the home and bring their staff in.
And I just have one more now, and then I'll let some other people in. Where did you find that the, I guess, weak link was in Extendicare itself? Like where were these messages not getting through about policies to follow and ensuring that employees did follow them? Was it at the facility management level? Was it at the corporate level? Did you determine who was ultimately responsible within the company for these failures?
Well, ultimately within a company or any organization, it's the top. I mean, if something goes wrong in my office, I'm the one who's responsible. At a corporate level, I mean, Extendicare and the authority were both, they had plans in place, what you needed to have in place to make sure that you had staff in case there was an outbreak. And in my view, in those circumstances, Extendicare, the corporate level, did not make sure that its facility in Regina, Parkside, was prepared and had something in place to deal with everything they knew, all the limitations they knew about that facility. With respect to on the ground, I mean, we found that it was inconsistent. So it was the local staff who were not making sure that staff were properly screening and getting their temperatures taken and going in and being denied entry, or making sure that staff were or were following the public health orders when they were having their breaks. Those are things that you have to be on the ground to do. Let's, you know, to make sure that those are being followed. So it's at both levels.
That's it for me for now. I might be back later.
Okay, thank you, Arthur. We have Connor O'Donovan from Global, and so I will just unmute you, and then you can unmute yourself, and you should be good to go. Give it a try, Connor. For some reason you're in here twice, so let's see.
Okay, cool. Can you hear me?
Yes. Yeah.
Yeah. Okay. So in the report summary, it notes that when you're looking at staff screening, you asked Extendicare performs
I can't hear you.
I apologize. I'm getting a little bit of an echo, and I'm going to see. Okay, try again, Connor. I'm just going to see if I can get you coming through on one instead of both of your.
Okay.
Yes,
yeah, that just might be because we are recording back at the station and I'm at home. But anyways, so you can hear me? Yeah. Okay. So yeah, the report notes that you asked Extendicare for screening forms to prove that staff were being screened and that they had been destroyed. I'm just wondering if there's anything in any of the that policy that they've been required to follow that says they are not allowed to destroy those forms, or just any other comments you have on the fact that there was no proof that staff were being screened for COVID symptoms when they came into the facility.
So yes, because of that was one of the key findings we found when we were looking at the outbreak timeline, is that we knew that staff had been coming in for quite a bit with symptoms. So we wanted to look at what the screening thing, what the screening form said, and to make sure that they had signed in. When we asked for them, it took a couple weeks. They were looking for them, and then finally they said, "Oh no, they've been destroyed." And so we thought that was if they were, and they said they were destroyed as a matter of routine after 30 days. They didn't have to keep them. I'm not sure if that is correct. We asked for the basis for them being destroyed, and they provided us with an authority standard which says that if you are screening visitors to long-term care facility, and you can destroy those things after 30 days, because by that time, if someone's come in and someone's caught COVID, they'll be able to contact trace with that information. So I did find that it was interesting that those were destroyed, because that certainly that document did not give them the authority to destroy those. And so I don't know when they were destroyed, but I know when we asked for them in well after the pandemic, they did look for them for a while and then realized that they had destroyed them. So that's the only thing we just put the facts in of what they told us. There's not much else we can say,
Okay, and then I also noticed in the report, you make a sentence there. It says something along the lines of, as early as March 2020, the authority and Extendicare were aware that the 4-bedroom or the 4 resident per room setup would potentially have be ripe for a pandemic to have very bad effects. So I'm just wondering exactly why you say that that as early as March 2020, specifically to the 4-person per room thing, both parties were aware that this setup would really not be ideal if COVID were to enter the facility.
Well, we thought it was important to point out that it was being discussed, 8 months before the outbreak, and everybody knew it was going to be a problem. And when the outbreak happened, we still had 4 residents living in the same bedroom. Our role as an ombudsman is to point out the facts and then comment on the facts. And so that was a fact we thought was worth mentioning.
That's everything for me for now.
Okay, thank you very much. We have Guy Kenville next. You are unmuted, Guy. He is with CBC. So you just have to unmute yourself as well. There you go.
Hello. Thank you for your time today. Your report goes into quite a bit of detail about the early phase of the outbreak, particularly describing the staff member who is believed to be the first person to have shown symptoms. You know, it goes on to say, for example, that this person, even while showing symptoms, went to a doctor and declined that doctor's advice to get tested for COVID-19. And then you go on to describe, again, in a lot of detail, how some workers didn't take proper precautions. They carpooled together unmasked. They sat in a break room next to each other, very close, unmasked. So I'm wondering if, two-part question, what did you make of those anecdotes about staff behavior at the onset of the outbreak? And what message, given that, what message do you have for healthcare workers working in long-term care homes today, given, you know, we still face the potential of a fourth wave and the Delta variant? So what did you make of what you heard, and what message do you have for healthcare workers right now?
Well, the comment on all the detail we go into, again, we thought it was important to include the detail of what happened, what people were thinking, and how bad it spread in the facility. A message for, I think it's a message for all of us. It's look at what there's obviously nobody wanted anybody to get sick or get COVID and die. But these people were coming into work with symptoms and caring for old people. I mean, we don't blame people as an ombudsman. We look at what processes were in place and were they effective, were they being followed properly. In this case, as we found, Extendicare Parkside was not ensuring that its screening processes were effective and working properly. We heard lots of detailed information about what we put in our report about how people were being screened, how lax it was. Some just walked around when the temperature was getting taken and didn't bother. So we put the onus is on the organization itself to make sure that its staff is following proper protocols and being denied entry if they have symptoms. You know, that's where we focused on, is what could the organization do to improve how they carried out their role.
Just another question, because I want to give others a chance. I want to switch gears here. Your report talks about, in much greater detail than has been publicly reported to date, about this decades-long lobbying effort of Extendicare's to have its facilities in Regina, Parkside, which is a really old facility, replaced. You know, on the one hand, Extendicare is it's a private company. It's contracted by the SHA to run Parkside, but it's a publicly traded company that has posted, you know, profits for many years. So on the one hand, you have Extendicare, a profitable company that is contracted by our government to run this place, that is asking the government to cover the cost of an upgrade. And on the other hand, you have both government and the company ahead of the outbreak flagging issues with the building, particularly crowded 4-person bedrooms. So my question is, do you actually think, I mean, who should sort of take responsibility for replacing that facility? Do you believe the government has an obligation to effectively subsidize a private company and replace that facility? Or do you think the onus is squarely on a private, very profitable company to replace a building itself with its own money?
So specifically, when the minister requested us to look at what happened at Parkside, he asked us to look at the physical condition of Parkside and whether that had any effect on the spreading of COVID-19. That is why we went into all the detail that we did. We thought it was important for the public to know what officials knew, that there has been talks for 10 years as to the facility being old and outdated, and that Extendicare expected the government to provide a significant amount of money to fund any rebuilding of those facilities. Whether or not public money is spent or sole source to a private operator is beyond the scope of an ombudsman. That is a public policy decision that is up to our elected officials. But we thought it was important to point out the facts of that everybody knew this was old, 4 people shouldn't be in a room, and 4 people were still in a room when the outbreak happened. That was the point of us putting all that detail in.
Thank you very much.
Thank you, Dee. I see, now I just want to check with folks. I see Arthur has some more questions, but if anyone else who hasn't asked anything yet wants to ask a question, I would invite you to put a quick note in the chat. But in the meantime, I will go to Arthur because he has indicated that he's ready.
Thanks. Yeah, just a couple more here. Some of the failings here seem pretty basic and pretty obvious. Like one that I found striking was that they weren't even aware of the continuous masking requirement and that they would need to have 4 masks per shift. I mean, I'm fairly sure that I was aware of the continuous masking, rule at that time. I believe it was publicly available as a public health order. So how is that possible? Like, did you get any, explanation for why they didn't know that they were supposed to abide by that rule?
Really, I think I don't know. I mean, yes, you're right. When the orders are made public, when they are issued, we read them clearly and we double checked to make sure that it did apply to residents of old folks' homes, and it did. It said the November 6th order clearly says any individual in a long-term care facility is supposed to wear a mask, except if they're in their private areas, which just means their bedroom, or if they're eating, they aren't unable to understand, the wearing a mask. And if they have a physical disability that would not allow them to wear a mask. So that to us is, I mean, you're right. It is, you would think that everybody would have been aware of that right away and enforced that order, or at least tried to have anybody who could understand the need to wear a mask or could physically wear one to be masked. But it was very interesting that it wasn't done, and it was interesting that the authority, I mean, from the information we were given, it wasn't until December that they sent a memo to long-term care facilities saying that the order had just changed and that they had to start masking their residents. So we just put the facts out there of what we found.
Okay. One more here. Why did you choose to take a more focused approach on this case, just really looking for the most part at this outbreak itself, instead of taking a broader approach, looking at the long-term care system, kind of like you did with the Taking Care report?
Well, I'll tell you, we got so much information when we, issued notice what we're going to look at. We decided that the best we could do was to look at what happened during this outbreak, and I think the public had a right to know what happened. And I hope that we've done a good job of explaining what happened basically in November, December inside of Extendicare Parkside for the public to see. And then we just decided that we would focus on 5 specific issues because we wanted to get this done in a timely manner. And we feel that because of this and seeing how the relationship between the private operator and the authority work, that we have been able to make some recommendations that will help the whole long-term care system and how private operators or any operators of long-term care homes are accountable in Saskatchewan.
Great. Thanks so much for your time.
Okay, thank you. And we will take one more set of questions. I have Guy Kenville would like to come back and ask some more, and I don't have any indication from anyone else. So this will be the last set. Thank you. Please
well,
go
again,
ahead.
I wanted to ask again about staff talking to about going to Extendicare early in the outbreak, perhaps even pre-outbreak, and continuing to work while symptomatic. My question specifically is, what did staff tell you about why they chose to continue to work while symptomatic? I note that in one part of your report, you indicate that some staff reported being, quote, harassed if they needed to stay home because they were symptomatic. I'm hoping you can elaborate on what they told you about why they continue to work while sick?
Well, I do think that, I mean, we reported on what people told us. My understanding is that that they did have sick leave available if they needed to stay home, if they were sick. I think it goes to show that, as we found during the pandemic, and that lots of people are sick and they think they're not really sick, or it's not COVID and it's something else, and they continue on with their lives. And look what happened here.
This might come across as harsh, but do you think there's the basis for an investigation into potential criminal negligence on the part of anybody, whether it's workers, management, upper brass at Extendicare, the SHA, or the Ministry of Health? Do you see any grounds for that within your findings?
I can't say that. So our investigation, because it's an administrative investigation, we have very wide powers of investigation of what we can look at. And we're not bound by the same rules of evidence that a civil court is, and the information we gather during a proceeding can't be used in any other proceedings. So it would be up to those other bodies to figure out if there's something that is criminal, or like what you said, it's nothing that we would be able to comment on and what we looked at.
Okay, thank you.
All right. Thank you, Guy. And thank you, everyone.
Thank you very much.
Have a good day.
Bye.